Yogi Berra, in theory, there's no difference between theory and practice, but in practice there is. Today, what we're going to try to do, which of these strategies works in practice? I have to say this is one of my favorite papers of all time. What it does is it figures out a way to try to identify of all those strategies you chose from, which ones make the biggest difference. So the first thing that Susan, Michie and her colleagues did to try to identify which strategies work is create what's called a taxonomy. A taxonomy is used in all sorts of... For example, you can use a taxonomy to say that, okay, this is a chimpanzee, this is an orangutan. It's trying to say, well, look, and they're all both monkeys. So when we look for behavior change techniques, you might say, well, this type of goal is a behavioral goal, this type of goal is an outcome goal, and they're both sort of goal setting. But goal reviewing goals, which is a different type of process. So the first thing Michie did was try all the behavior change techniques that have been done for diet and physical activity into these different categories. This is an evolving process doing this, but with this paper in 2009, what they did is they found all of the papers that have used these to promote physical activity, healthy eating, or both. And they found 101 different papers looking at 122 evaluations. That's a number of studies to try to classify. They looked at anyone trying physical activity or healthy eating, and they had to be measured by some sort of objective or validated measure. They didn't include any health problems or any athletes, anyone in jail, or any pregnant women. Just normal, healthy adults like Bev who are trying to change something in their life. These interventions of 22 comparison groups, there was everything from a single session teaching someone a skill to a 2.5-year program that was trying to help them change their behavior. On average, from that list behavior change techniques, most interventions, which is kind of what we call something that uses multiple behavior change techniques, used about 6. Almost all of them strategy, and the control conditions usually used 1 or less. So what these studies were doing, a couple of these behavior change techniques to create an intervention, a little bit like the one that you're doing for your assignment. And then they compared it to a control group who maybe only used 1 or 2 of those techniques as a control condition. And the question here is, which of interventions and which of these behavior change techniques had a strongest influence on someone's health, their physical activity, and their diet? A little bit like the self-efficacy earlier, what this paper did was look at 2 separate interventions, and it said, well, if this intervention included X, Y, and Z, and this intervention included X and Y, and this intervention did better, then there's something about Z that's promoting physical activity and health. In this case, Z as a moderator, something that tries to influence the relationship between the intervention and the outcome, between the program that had all these interventions and healthy eating or physical activity. This paper also tried whether there was anything else that maybe moderated the effect of an intervention. Maybe longer interventions were more effective than shorter intervention. Maybe the intervention was better for populations or different contexts. Maybe it was better for healthy eating rather than diet. So what I want you to try to do, as usual, is spend a little bit of time trying to digest the information yourself. As we probably mentioned before, these tables will be given in the exam. So we're not really assessing your memory of the different effect sizes. Instead, what we want you to be able to read the tables yourself and identify which effect sizes are strong and which are significant. And if we've got multiple effect sizes, try to compare the large ones with the small ones and see which has the biggest effect. This table is ridiculous. And so I'm not going to pare it right back to the very basics, but I'm going to leave it to be a little bit more complicated because I know that you guys are getting better. Now, one thing that's new is this isn't necessarily a typical meta-analysis. It's what's called a meta. And that means we're using something called a beta value instead of a typical kind of effect size. And basically, what the beta value is doing is looking at the difference between the effect sizes when the technique is in and when it's not, between the yes. The confidence interval is the same as usual. We want anything that doesn't cross 0. But the idea of a beta value is that if that's significant, then it means there's a significant difference between yes, including the intervention, and no, not including it. So see if you can work your way through this table and try to identify which of the 26 strategies is going to be significantly effective for promoting physical activity and healthy eating.